COVID-19 cases continue to rise in most states across the country, including here in Massachusetts. And Baystate Medical Center in Springfield has been treating COVID patients since the outset. I spoke with Dr. Mark Kerouac, President and CEO of Baystate Health, to get an update on how the treatment of the pandemic has been going at the hospital.
Well, as far as patients in the hospital, the numbers have been very stable. They've been between 10 and 20 for many weeks now. This morning, there were 12 patients. Only one of them needed to be in the ICU, which is way, way below where we were back in April when we were at 180 or so with 40 in the ICU. So for patients in the hospital, it's a pretty small and stable number. This is in spite of the fact that it looks like cases in the community are going up based on the public health data, as well as cases across the state.
Are the protocols still in place at the hospital that you implemented back in April in terms of keeping, the patients, the visitors, the nurses, doctors, and staff safe?
Yes, in terms of the protocols everyone follows, everyone in the hospital wears a mask. We've set up spaces to maintain physical distance. For those units taking care of actual COVID patients, they have a more special mask called an N95. The staff wear gowns, gloves, eye protection. So there's far more that we do when we know the patient has got COVID. We're testing everyone, all admissions at the front door. And so there's that screen. And we're also screening people for fevers and symptoms as they come and go. We have loosened up a bit on the visitor policy and are generally allowing one and in some cases two visitors, depending on the age of the patient and the clinical circumstances.
And how are those tests going? Are they going well? Enough tests to go around, obviously, and what are the results showing?
We're testing a lot more than we used to. We started early in April only being able to do 100, 200 a day. Now we're up to 1,000 a day, and we see anywhere from 3 to 10 positives on any given day. The rate of positivity, the percentage of positive tests, has been creeping up these past few weeks. So it had been at about 0.9%, and now it's at about 1.3%.
Dr. Kerouac, as you know, we're kind of entering the flu season right now. How is Baystate Health preparing in terms of the convergence of the flu season now and still dealing with active COVID cases? What steps are being taken to address that?
It is a very serious issue, and so consistent with the governor's guidance, we are mandating flu vaccine, flu shots for all of the people working at Baystate, and we're urging everybody who doesn't have a medical reason not to get one or a religious objection to get one. The issue is that we don't know what happens if flu and COVID infect a person at the same time. It could be a very serious problem. In addition, for a person with the flu who has a fever and cough and chills, they're going to look just like a patient with COVID. And so it's a bit of a false alarm where we do extra testing and we use extra personal protective equipment. So we're trying to keep the numbers of flu cases at an absolute minimum. And I'm hopeful that between the shots and the masking and the distancing, we can keep a lid on flu season this year.
And what kind of contingency plans are in place, Dr. Kerouac, in the event there is a resurgence or a second wave, if you will, of COVID-19 patients?
Well, we are required by the governor to keep a stockpile of personal protective equipment on hand and to reserve 20% of our bed capacity in the event of a surge. Now, fortunately, we haven't needed that, but we are monitored by the state to make sure that we have those open beds in case a patient surge occurs. Now, what happened with the first surge is that we also closed down our elective surgical cases, which opened up a whole bunch of additional beds. And so we're confident that we could accommodate patients with COVID if indeed another surge occurred.
Dr. Kerouac, we hear of some patients who have contracted COVID getting better, but then eventually having complications down the road. Are you seeing this at all at Baystate Health? Are there patients you've treated for COVID who have been released, with no symptoms and testing negative, eventually coming back with follow-up symptoms?
Well, what's beginning to become clear is that patients who have a serious COVID infection may have lingering symptoms of things like fatigue, confusion, headaches, fevers, joint aches, sometimes permanent impairment of their kidneys or liver. We don't really know what percentage of patients overall this is. It's probably a small percentage, but the case reports are starting to come in for people who have had persistent symptoms that have been very, very debilitating and have kept these individuals from returning to normal activities. In terms of patients coming back to the hospital, there are about 10% of the patients who will be readmitted because they haven't fully recovered or they have some other kind of complication. But the sort of problem that I'm talking about is something that would more likely present to a doctor's office as a failed resolution of the overall infection. And so we're reading about cases that have gone on for weeks and weeks. There doesn't seem to be persisting virus, but rather an immune reaction to the virus that's long lasting. And this has happened with other viral infections as well.
Dr. Kerouac, in terms of treating the COVID patients over the last several months, has Baystate had enough equipment, enough ventilators, respirators, PPE, and so forth, or did there come a time where you were running short on those necessary items?
Well, we had some concerns about shortages very early on in the epidemic when we were up close to 200 patients with 40 in the ICU. These days, with the numbers being relatively low and with us having secured additional sources of supply, we're in very, very good shape and have many weeks in reserve right now. We never pushed the limit as far as ventilators go because we were one of the early hospitals that figured out how to avoid using them and allowing patients to get better more quickly. So we were pleased with that. So right now we don't have shortages in terms of being able to treat patients. Our major area of shortage and concern has been the ability to test people. And while we're doing up to 1,000 tests a day, I'm sure we could do 2,000 or 3,000 if we had the additional reagents and equipment. And we're working on that.
Dr. Kerouac, just want to get your some final thoughts here in terms of your message to the community as we move forward now. What would you like the Western Massachusetts community to be aware of in terms of COVID treatment going on now, and obviously that a big question mark over how serious the flu is going to be this winter?
Well, people have been hearing me say the same message for weeks, Ray, and it's basically wear your mask when you're out in public, observe social distancing, wash your hands, get a flu shot. We really know that whenever we follow those kinds of precautions, outbreaks are unlikely to occur. And the increase in cases that we've seen in Massachusetts and across the country usually happen when people decide to either forget about these things or somehow take a break from them and have social gatherings in which they pretend it's 2019 all over again. And that's when we get into trouble. So continuing on with that same advice is going to be our key to maintaining our good record and allowing ourselves to gradually get back to more and more activities that we all miss.